Who's going to do the PowerPoint for us?
I can drive.
Okay.
Oh. He said, can we bring that this way?
Yeah, in between those two.
Like on this side of the...
Dan's a lot taller than I am. He may just take it off. I'm going to try to stand right here.
Keep bringing it. Keep it going.
We go here, Mariah?
Yeah, that looks good for that one. This one, we might need to focus, but it looks...
That's the weight reducing camera you have?
Huh?
Weight reducing?
Yeah.
You can be whoever you want. It's virtual reality.
So this one's a little dark on the person, but that one's perfect.
Let me just see. Yeah, and as you get down,
Yeah.
it's going to be okay.
Yeah.
Awesome. So that's good.
Is that one recording?
Let me, yeah, it's recording.
Yeah, that's going too.
I'll get the iPad going right now.
All right.
Awesome.
Is this on? No? I can't see to turn it on. How's that? That's better. That's better. All right. Well, thank you, everyone, for attending this forum and also for being good with coming to the gym. We had some requests for that, and I think that makes a lot of sense to model the behavior that we're trying to influence throughout the college of just maintaining space where you can and just following good preventative measures. So we wanted to spend this time today to talk about our favorite subject, which at least some of us have to talk about a lot, which is COVID-19. If that wasn't your favorite topic, then we'll come up with another one, but today that is the topic. And we're going to be talking about what the guidelines are out there from our partnership organizations, and we're going to talk about what the current steps and procedures and practices that we've been taking as an institution, and then we'll have time for questions and comments and try and relay the most recent and best information that we have to date around this concerning what the system has also undertaken. So, you can go to the next slide, Nick. These are a set of guidelines, and I have this one slide. So these are from the CDC. If you go to their website, they have a set of guidelines for several different situations. This is a set of guidelines for institutions of higher ed that have not had any reported cases of COVID-19. So these are the things that they have said are good practices for us to implement at our own campuses. And you can see them up there of reviewing and updating the emergency response plans and really making sure that you have a strong set of guidelines that guide your actions and your decisions around the things that you do that follow this particular bullet item, which includes developing information sharing systems with your partners, which we are doing, and Dan is going to come up here in a few minutes and talk about that, who our partners are, and how he is engaging with them as being part of the member team. We're monitoring and planning for our absenteeism for faculty, staff, and students. We'll talk a little bit more about that later on. We're establishing procedures for those who may become sick with any type of illness, and really the biggest step that we've said there is if you do not feel well, stay home. We're saying that to anyone and everyone on campus, whether you're a student or an employee. If you are not well, do not come to college. If we have an event or a meeting and someone has said they don't feel well, don't come. We just want to make that very clear to everybody. We're performing effective cleaning practices. George and his crew have been very diligent on that. We will continue that work. And we're creating timely and informative communication plans. So breaking that out of what we're doing to help meet those guidelines through the CDC is a set of what the goals are. This is what we've shared through our President's Council meetings, probably through the team that Dan is coordinating and with teams across the system. as well as the college. And our goals include to remain vigilant in the use of preventative measures, to keep colleges open and classes running, to support all of the employees and students with resources and information, and to respond in a timely manner to situations that may come up. So here's how we're doing those things. We have created an Eastern Maine Community College COVID-19 team, a response team, and campus contact person. Our campus contact person is Dan Crocker. If you're on the team, will you, if you're here, if you'll stand up so we can see all the team members? Excellent. So they meet regularly, or they will be meeting more regularly, and going through the situations that we're experiencing on campus, sharing information that they're hearing, that Dan's hearing from the system office and from the CDC, and then relaying that back to all of us. We're establishing professional organizational partnerships right now with the Maine CDC and CDC to get their guidance and feedback and information, and how we share that back out or use that for our decision making. We have developed communication strategies, so we are providing regular updates. We have a website page that's dedicated to this, and it's now linkable from our homepage. There's frequently asked questions that you have a link to from our college website that takes you to the Maine Community College System website. There will be, the newest update will be probably in the next hour, and it's specific to travel. So we're going to be sending out information on that, about what has changed, but I would say I would visit that page very regularly just to see what's new, and we will send out, if it's big new information, we're going to send that out to everybody to say go back to the frequently asked questions. We have posters that have gone up, and we have a specific email address for people to either send questions or send information or recommendations specifically to that address, so it doesn't get lost in a series of other people's emails, and they can respond quickly. And we've, additionally, Brian and his team are working on level 1 and level 2 responses to residence halls. We're sharing that with the system. That's still in the works, it's still being completed, but I think that will provide excellent information for our students who do live on campus. As faculty, you're drafting an instructional continuity plan. Those are due by Friday to the system, and Brian will be having a meeting, a Zoom meeting or a conference call with the other colleges to talk about what that means and what are the best practices. That is being led from best practices across the nation right now, and what a continuity plan is and how can we best use that. George and Flick Dining Services have already instituted additional safe food handling protocols, and we're also looking at, with our resident students, if something should happen, how does that change for dining services for them? We're restricting non-essential travel and new requirements for those returning from travel. So if you already have travel and you haven't talked to somebody about that, whether it's to a conference or to an out-of-state meeting, then you need to talk to a supervisor or talk to me or talk to Dan, but really all non-essential travel has been stopped. The only thing right now that we're considering essential travel is admissions work, and that's really within the state, and it's really only to our high school partners or other institutions. We're not doing college fairs or those types of things, and as long as high schools or other schools are interested in maintaining that partnership to the extent that they are comfortable with that, then those can continue, but that's really going to be evaluated every day as well. And we're reviewing all on-campus events on a case-by-case basis. So we have Skills USA coming up next week. Hal has a board meeting tonight, and we've talked to superintendents, we've talked to other colleges. Right now, as of today, that event is still going to go on, but we will let you know if or how that changes. We also have our EMCC Connect Day. At this point, we're saying that event will go on, but again, these are day by day, usually hour by hour conversations. So we know that we need to make timely decisions about how that will happen, and we will just keep everybody informed. If you have additional information or you have information that you want to make sure that we're aware of, then please, please, please let us know, either through that email address or talk to Dan specifically. And finally, we have a frequently asked questions. I wanted to draw your attention to that just because that really, our website, which has a subpage to COVID-19, as well as the frequently asked questions, those will be the best sets of information that we can provide in the most efficient way possible. So, what I'd like to do now is have Dan come up and talk about what he knows of today and address any of the other areas that I've covered that you think need more information. Thank you.
Thank you, Lisa. Pretty much everything that Lisa just covered in the slides is the understanding that we have at this moment. I am a part of the Maine CDC conference call system. Every Monday at 1 o'clock they have an update. Their information is sequestered. It's not public information, so you won't see most of that on the news because they have restricted access to that. They do that update through their press release system. I would encourage everybody to use the links that are on the PowerPoint that we have provided in the website as well. The only reliable information anywhere is either the CDC or the Maine CDC. Do not try to get your information from Fox News or CNN or anywhere else because it will always have some sort of bias in it that isn't factual. The latest report, I just checked, the Maine CDC updates their report every day at noon. The only real change, the number of reported cases is now approaching 1,000. The number of deaths has gone up a slight bit, and the number of states infected is now 39. That's up from 35 yesterday. On Monday, the director of the CDC indicated that they are putting all of their staff power into the COVID-19 response. They have 50 people dedicated to only that. I have no idea how many people work for Maine CDC, but that seems like a fairly high number. They are preparing not for containment, not for avoidance, but dealing with sustained community transmission at this point. Now, they always will plan for that worst case scenario, but I think that the message that I'm getting from them and the message that we want to convey to you is that we need to be prepared through all these action plans that we're taking to meet the goals of the institution, but at the same time maintain the health and safety of our students and staff and faculty. And so when we talk about continuity of services, that means how do we deliver instructional activities in a different format and still meet our accreditation and institutional requirements. How do we continue to admit students and register students and serve students in ways other than face-to-face contact if in the event that we do need to have either a stay-at-home decree or worst-case scenario, a quarantine situation on campus. At several different meetings this week, I have kind of gone over some of the ABCs of taking care of yourself. What you're witnessing here is our first example of that. We had scheduled this meeting, like most of our forums, in the auditorium. And when I came in this morning, I was strongly advocating, because of some feedback from some faculty members, why don't we just practice what we preach? If we really want to engage in common sense social distancing, having events in large, well-ventilated spaces, and providing continuity of service, how hard can it be to move from one place to another? It literally took Brian and I and the maintenance staff and the IT staff about 20 minutes to get this set up. So those are the kind of things we need to think about. Obviously, and I met with the student group yesterday, stay calm, wash your hands. That's the primary message coming from every healthcare provider that we've talked with. Most of the transmission at this point is happening because you've touched something with germs on it and then you touch your face. It's very, very difficult not to touch your face. As a matter of fact, the director of the Maine CDC was on the conference call, which was a video call, and I stopped counting after 30 the number of times he touched his face, even though he said, do not touch your face. And I think it's just a subconscious reaction that the more you think about it, the more your face itches. However, wash your hands very, very frequently. I've gotten into the habit of washing my hands before I touch my glasses, move my glasses, then wash my hands. Got my Purell right on my desk. I'm going through it pretty quickly. The other thing, and it's one of those social norming things that we just need to adjust, at least for the time being, the CDC is recommending that we forego the social nicety of handshaking. Fist bumping, that doesn't really help either. The best thing to do is smile and nod, and there's your greeting out of the way. But if you can avoid shaking hands, you can avoid touching each other. That's the easiest way and most effective way to reduce the spread of the virus. Obviously, the housekeeping staff, you've noticed in the update, they had gone into their influenza season cleaning, which is a little more attention paid to high-touch services like light switches, doorknobs, tabletops. We've provided, and I think it's in every classroom and office by now, some type of disinfectant wipe. I know Pilar had a suggestion for a more potent that we're working to get, but the CDC did release, actually it was the EPA on behalf of the CDC, released a list of approved effective cleaners, and the Clorox and Lysol wipes are on there. They're just not as quickly effective. One thing to do, if you do wipe your desk down, wipe it down and leave it wet for a bit. Don't just wipe it down and then immediately dry it off. The longer it stays, well, it's not the longer, but it does have a reactive time. So wet your desk down or your keyboard or whatever it is, and don't immediately wipe it off. That's much more effective. Lisa mentioned travel advisory. The system office has decreed a non-essential travel restriction. We've had conferences canceled. Yesterday, I pulled several of my staff out of various conferences they were going to this week. As Lisa mentioned, admissions staff will still do their routine course of action, and I haven't even had a chance to talk to Stacy. It's been a busy morning, but unless a school is closed, we're going to continue doing our school visits, our high school visits like we've always done, exercising all of the normal, social distancing, hygiene issues that we've talked about. We are probably going to avoid large things like college fairs, career fairs, those kind of things, at least for the short term, until we get other guidance from the CDC. The biggest thing to be aware of is, and I can't reiterate it enough, there is so much bad information out there that I encourage all of you to go directly to the CDC. It's a lot of information there, but you can find what you're looking for if you poke around. The other thing, if you do find interesting or what you think are helpful articles or news links or whatever, don't just send them to Brian and Lisa and me through our normal emails. I am literally drowning in emails right now, as you can expect. We have set up the response team at emcc.edu email box. I'm monitoring that. Mariah has access. Chris Whalen has access. We may add others to that as time goes by. But if you find something that you think everyone should know about, send it to that email address. I will vet that with my response team and then send it out if it's factual and appropriate. And I don't doubt any of your intelligence in discerning fact from fiction, but there's so many conflicting things going on out there that I am relying solely on the CDC because they are the experts in this. I think I want Brian and Lisa, I'll turn it back to you, but we're going to have plenty of time at the end for Q&A. But if there's anything related to what I just said, I'll take those questions now, and then we can just have more of an open discussion at the end of the presentation. Okay, good. I'll turn it back. Oh, yes, I'm sorry, Stacy.
Yes, since you're my supervisor too, how do you feel about large work coming to campus?
The question was, how do we feel about large tour groups coming on campus? I think as time unfolds, the situation may change. Our guidance right now is to exercise social distancing, hygiene. I mean, one of the things that I've been telling everyone when they walk into my office, there's a Purell, wash your hands and sit down. So I think if we exercise that at least for the interim, and we will seek more guidance from our educational partners and our CDC partners about that.
So just a few things. I spoke with department chairs on Monday and transmitted a document that, oh, louder, got it. So Monday I met with department chairs and I circulated a document that provided some initial guidance around our instructional continuity plan. A revised version of that is going out today, and accompanying it will be a document that Nick Runco has been working on that is modeled after Indiana University's guidance around maintaining instructional continuity. And I just want to emphasize that the objective is to plan for what would we need to do. What would you need to do as an instructor for different types of classes? We have a lot of complexities that other schools don't have. So you've no doubt seen that a number of schools have said folks aren't coming back after spring break. Most of those are liberal arts schools that have pretty much all classroom-based instruction. We have a lot more complexity in our implementation of our curriculum than that. We have folks in clinicals, we have folks that are doing hands-on types of activities, you know, learning situations, whether it's in HVAC or it's in welding or it's in a variety of other areas. And it makes it far more complex to consider. The guidance that we're going to put out today doesn't discount that complexity, but it does help, I think, to push us to think about what are the key objectives, what are the things that we can accomplish, what are the pragmatic, practical things that you can do, and rather than try to focus on what would be the best possible scenario, what is the possible scenario? And I think that that's really what we need to stay focused on. I'm just checking my notes here. So we are seeking additional clarification from NECHI still, although when you look at the accreditors' regional, look at their website, what you see there is a guy is directing you to the U.S. Department of Education. And the U.S. Department of Education's guidance is that pretty much all regulations will be relaxed during this time of emergency. So when we think about what are our flexibility, what are the opportunities for us in how we have to respond to this, we're going to have, at least from the US DOE, a great deal of flexibility in dealing with this. So that's good news. I have asked each of the individual program chairs who have specialized accreditation, so I'm looking at Pilar here and thinking about nursing and ASIN, for example. What is the guidance from each of those accreditors in relation to any need to modify the curriculum, any need to modify the delivery of instruction. On another note, where's Chris? Chris, where are you? Kelly, do you want to come up for a second? So the other piece of this is thinking about our residential students and what is the basic plan that's in place. And Lisa mentioned a little bit about level 1 and level 2, but I'd like Chris to talk for just a moment about some of the specific pieces that we're planning for around all of our residential students, and then sort of more broadly for engaging with our students overall. So Chris, you want to come up and share that?
Sure. So we are planning all of our student engagement and residential life pieces in accordance with the CDC. They have several tiered approaches for what you should do if a student is diagnosed with COVID or if there are COVID diagnoses in your area. So following those, we've made some tiered responses for Res Life. And this impacts any student that lives on campus, but also students that visit campus and visit our residence halls as well. Sorry, I've been living on the CDC website, so this is all, I'm writing it as I go. So our tiered 1 approaches are essentially geared towards where we're at right now. Right now we're in level 1. Everything is good to go, essentially. We're functioning under normal understandings that people should be practicing good hygiene, social distancing, and we're increasing that communication to residents because they not only live on campus and are in classes, but they're sharing bathrooms, they're sharing living quarters, they're at a higher risk for transmittal of the disease. If there's an infection in the building, it will spread a lot faster, essentially. So we're looking at ways to start cutting that down in level 1 as we prepare for level 2. It's almost guaranteed that level 2 will come. There will be somebody in the state of Maine, somebody in the Penobscot County region that has COVID, and that's when we'll start to think about level 2. Level 2 is really limiting who's coming and going, limiting what kinds of activities we have going on, and worrying about our student staff as well, and doing what we can to take extra precautions to protect them, because our student staff aren't just our student staff. We have student staff that work in admissions, we have student staff that work for housekeeping and facilities management, etc. And it's not really an option to just say, yeah, we're not going to do any of this anymore. Housing is very important to our campus because without it, a lot of our students can't be here. So we can't take the same opportunity that other colleges are doing at this stage and just saying, you know what, COVID's around, we're going to shut down. So in doing that, we're following along with the CDC and connecting with our facilities partners and our dining services partners to ensure that we are talking about things like single serve opportunities and takeout options and limiting how many opportunities there are for students to transmit bacteria. If we have students who are coming down sick, we're referring them to the PCHC Center in Brewer for testing. Most of our students know where they've been recently, which is nice. If they haven't been to a hotspot for COVID, they probably don't have COVID. If they haven't been in contact with anybody with COVID, they probably don't have COVID, but they're still being encouraged to get tested for the flu and letting health practitioners make that decision as to whether or not they need to be tested for anything further. We're asking that they relay that information to us so that we can follow best protocol by CDC, which is pretty clear cut, and we're working with Brian and the rest of the leadership team to make sure that we're getting the information we need from the system to make that work. But really right now we are operating the same as the college. Everything is all systems go, but we're keeping a very close eye on everything, and we realized that we could be in a very different situation in an hour. But if anybody has any questions about how Res Life is approaching COVID, I would be happy to answer those now or later. Is there anything else you wanted me to cover, Brian?
I think that's good.
Okay.
So before we open it up to questions, I do want to read you what is going to go on, the frequently asked questions specific to travel. So you're aware of that, and that will be posted later this afternoon. Under that, the question is itself on the website is, what about travel? And it says, in order to minimize the potential spread of the virus, Maine's community colleges are limiting college-sponsored travel for non-essential purposes. You should check with your supervisor to determine whether to proceed with any college-sponsored travel plan through June 1st of 2020. Members of the college community who have traveled outside the U.S. in the past 14 days or who plan to travel outside the U.S., including Canada, in the coming days should complete this short form, which is attached to that frequently asked question, before leaving or returning to campus. So there is a document you need to complete and then submit back. It's going to go back to the system office and then directed to the specific campus. If you're traveling within the U.S., please consult the CDC website, which tracks the number of confirmed cases in each state. It gives the website. We strongly encourage you to consult this list before traveling to avoid areas with significant outbreaks and to observe CDC recommended steps to help protect yourself and prevent the illness. So that will be the most recent update. There might be even some other additional changes to responses to those frequently asked questions, but make sure today, if you have questions about that, to go there and check out the forum, or if you have additional questions specific to that, see Dan or your supervisor. Okay, Lou?
The restriction on travel out of the country, is that only from June 1st?
He asked, is the restriction on travel through June 1st?
For leaving the country?
Well, what we're saying through the June 1st date is any travel on behalf of the college.
Oh, okay.
Yeah. Okay, what other questions do you have?
Does Dan have any information on how many testing kits they have available through Maine CDC or have been distributed?
So the question was, does Dan have information on the number of testing kits that are available or being used in Maine?
Yes and no. If you actually go to the Maine CDC website, it does indicate the number of tests that have been administered and what the results were. The CDC, both Maine and national, are only tracking those numbers if they conducted the laboratory examination. So there are several, well, around the country there are many independent laboratories that are sponsored or funded through the CDC. And as we probably have all heard on the news, we have no idea actually how many tests have been administered in the U.S. They're working to clean that up and get some real numbers. The conference call on Monday, the director did not indicate an actual number of kits that are available in Maine, but they did say that they have a supply that they are triaging and sending out to areas where testing needs to occur. Right now, the medical, and perhaps any of the allied health professionals in the room can answer this better than I, but each of the hospitals and nursing homes and any other critical care units in the state have directives from the CDC as to how to evaluate and assess if an individual should be tested. The testing only became available on March 5th, so there's a backlog, obviously, and it's also why the CDC is quite certain that we already have cases in Maine we just don't know about yet. So to answer your question, I don't know the actual number, but the director was very concise in his response that adequate testing kits are being sent to those areas where they think they need. The other piece of that, though, is PPE, personal protective equipment, is quickly becoming short in supply, and even though the Maine CDC has a stockpile of those, they're also triaging those, anticipating that if they just send everything out all at once, then it will be not available. And both the Fed and the state CDC are working with their supply chain partners to provide ample supplies of that. So obviously this is going to become more and more of an issue, the PPE especially, as more and more cases are sent to critical care units, and the first line of defense is to keep the allied health professionals safe while they're treating. Even testing can be a very difficult situation if you don't have the right protective gear, so they are working on that, yes.
And
So, in cases like general ed classes where you have half of your class not coming because they're either sick or afraid to, and you're prepared to go online, take the class online, are we allowed to do that? Because catching half the class up when they miss lecture is much more difficult than just saying, let's all go online and nobody has to come. Is that a viable option for us at this point?
so I'm going to ask Brian to come back up, and maybe Nick. The question that Anna had was, is it a viable option to move your class online? Specifically, she's asking about gen ed classes. If you have students who are sick and not attending, or who are scared to come to class. And so how do we address that? And potentially, if there's a possibility of moving online, is that something that we could do?
Yeah. So.
So I'm just going to answer this question from my own perspective. And that is that if you are fully geared up to teach your class in a robust manner online and to achieve all the same outcomes, then I think that we should be able to have that conversation. And I know that that is the move. For example, the University of Maine at Augusta announced that that is their plan